Hi, I'm Armin Brott with Men's Health Network, and we're interviewing a lot of the movers and shakers at the conference of the National Healthy Start Association, which MHN was a co-sponsor of. And I'm going to be talking right now to Robert Fairchild. Tell us a little bit about who you are.
My name's Robert Fairchild. I'm the chairman of the Fatherhood and Mentoring Initiative for the Psi Phi Fraternity International, and we do work with fathers and young men across America and around the world.
You know, when you were talking the other day, one of the things I thought was really interesting was the pre-fatherhood component that you were talking about reaching young men as young as 15, I think it was, who even before they think about becoming fathers. And tell us about that. That was really just fascinating.
Sure. One of the things that we started looking at was to try to get at before a young man becomes a father. We started really, the target was the college environment when we first started it. And the idea was to talk to young men about what it takes to be a father before he becomes a father and put some experiences out there. As we were doing that, we've had a couple of sessions, we had a couple of training sessions to show them how to do that. In the process of doing that, we discovered a couple other things. In the audience, when we first presented it, we would ask young men to come up who had fathers in their life to share that experience, those that didn't have a father in their life, but we found another category, and that category was young men who were already fathers. And that turned out to be real interesting because we wanted them to share their experiences as a young father. Young men who are in college having 2, 3-year-old kids and how they had to deal with that. And the trauma, because it turns out in many cases it's a traumatic experience for a young man who in reality did not expect to be a father, but now is a father.
But these guys are in college, though, so they did not get sidetracked by that, so they were able to somehow keep on track to moving towards a bigger goal. How do they do that? Because you hear, I mean, in the media anyway, you hear so much about you have a child, that's kind of the end of everything. You drop out of high school, you never go to college, and we all know what happens with income and health disparities and all sorts of things. How were these guys able to keep moving?
Well, that's interesting you say that because that's the issue. A lot of kids do drop out when they have kids, but those that stick it out are going through a lot. I mean, they express. That's why we wanted them to share, because there are a lot of things that they do. There are a lot of things that they're going through, difficulties that they have to work with, and it made it real interesting to see how they cope with the difficulties of making that transition. Dealing with the parents, because the parents bring about a certain amount of pressure. Dealing with the young lady's parents, that brings about a certain amount of pressure. The relationship between the two of them as they deal with a child. And in some cases where there is no young lady around, the father's got the kid, period, and he's taking care of that kid. That was really interesting. We've had one young man who started to discuss his concerns and the issues he was going through, the problems he was having, and he got halfway through his presentation and he just broke down and started crying. He was having a difficult time dealing with how he could handle the things that he felt he was responsible for, and he did. His message was, I refuse to not be able to take care of my kid.
One of the things that I've heard a lot about when dealing with single fathers in particular, just because you mentioned that, is the lack of support that there is out there. I mean, single moms, there's messages for single moms that are positive messages, there's groups, there's all sorts of social supports for them, but single dads, we kind of look at them as being some sort of unicorn or mythical beast that doesn't exist, and we don't know what to do with them. And so these guys are out there on their own. What are they doing for support? How are they getting it?
Well, one of the things that's a good issue. I mean, that's an issue that is a real tough one for them to deal with. And one of the things I know we've been pushing hard, we've had a couple of things that we've been working on in a couple of states. I know in Maryland and also in Virginia, we've had this conversation about shared parenting, where that thought process of what you do for that young woman, you also need to do, well, not the same thing, but you need to give that similar kind of support. Yeah, and that's an area that we've been working, trying to, because it is an issue that has popped up on our purview, and we're trying to work with it. What we also have done with young men like that, we've tried to give them, we call it a support group. And the idea is once we identify the individual, in fact, even that young man, once he started crying, we started talking to him, we found out what his problem was, then we started saying, okay, the brothers in that particular chapter decided to start working with him and assist him wherever they could to help him, address some of the things. And even support him in some of the things, some of the things like, I got class now, what am I gonna do with this young child while I'm in class? So all those kind of little issues started to pop up. And it's kind of interesting how once the problem is identified, okay, let us help you out. And just one of the things that has been that's worked out really great is find out what the problem is. Get to that root problem and find out what it is. What's your problem? What kind of help do you need? And that's where we've been trying to reach out.
And get them used to asking for help. I mean, part of the whole thing we've been talking about at the conference is this culture of masculinity, and we don't want to ask for help because we got it. We're under control, and in that kind of a situation, what are you going to do? You got to ask for help.
Yeah, and that was the kind of scenario that caused him to start. He was frustrated because he needed help, and he had gotten to the point he just was. And once he started talking about it, it kind of came out.
Did you talk to the guys who didn't have kids yet about that? Because I'm curious about whether that is in essentially kind of a birth control conversation, is that you get a chance to hear the challenges that somebody's dealing with, and you think to yourself, you know what, maybe I'm gonna, maybe reach for that condom or something to be just a little bit more careful.
Well, let me tell you something real funny. The first time I presented that, we had this at what we call we have an undergrad summit, a national undergrad summit, where we bring all these young men in. The first time we presented this thing, there were about 30 young men in the room, and we talked about it. And like I said, many times when you see young men, young people, they always got their phones out, playing with their phones. There was not a single person that had a phone out. They got into that conversation because I started off kind of just to, break the ice in the conversation. Look, guys, you come to college, you're having fun, you're young people, you see young ladies, next thing you get hooked up, next thing you know, you done hooked up and young lady's pregnant. And when I said it, everybody was ha 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 until I said, you're pregnant, the young lady's pregnant. Then the mood changed. And I said, now what you do? Okay, now you're a father. Now you might not like it, but you're a father, and you're gonna be a father for the rest of your life. And it doesn't soak into you right away until all of a sudden maybe that young lady decides, I'm gonna have that kid. When she has that kid, you are a father. Okay, that conversation, they say, how do you deal with that? We had that conversation. Well, as we were going, like I said, the second thing that happened is I brought the guy up. I asked the question, how many of you in here have had are fathers? And several, I was surprised the number that held their hands up. And so I said, I want 2 or 3 of you to come up and share your experience because I want these guys to know what that feels like once you become a father. So it's like when you're out here having this fun thing, you got to recognize fun can lead to something completely that you hadn't even thought about. The fact that you're going to be a father. It's a different kind of experience. Well, the conversation went so well during that day, they asked us to do it again the next day. The next day we had about 450 or 460 young men show up in that room. And the conversation even got deeper the next day.
That's fantastic. Robert Fairchild with Omega Psi Phi, thanks so much for being with us and for sharing your wisdom about this. It's a fantastic program. I'm Armin Brott.